Hello, this is Dr. Derek Haas with Conceive Fertility Center, and as part of our continuing web series today I'm going to talk to you about some home remedies for infertility patients. So these are relatively inexpensive tips and tricks that you can use at home to improve your chances for fertility. I've divided these up into two major categories: lifestyle factors and sex factors. So under lifestyle factors, some of these are very common sense, but number one, no smoking. Smoking is really bad for your overall health. It's bad for the egg, it's bad for the sperm. So use this as motivation if you need help quitting. Number two, for women, taking prenatal vitamins. So prenatal vitamins give the woman extra folic acid. That's going to lead to a healthier pregnancy. Number three are stress reduction techniques. So these include things like meditation, breathing exercises, yoga. Yoga actually is both an exercise and it has breathing techniques built into it, and it has a small amount of meditation built in, so it's a great overall exercise. And specifically for meditation, there are even apps that you can download to your smartphone, and they can help you through very short guided meditations. So this could be something from 1 minute to 5 minutes, just something to help you slow down in the middle of your day for stress reduction. Now under sex factors, there are things like the choice of lubricant that you use. So most over-the-counter lubricants like KY and Astroglide, those are all bad for the sperm, but there are some that are actually beneficial for the sperm. One is Pre-Seed, that's Pre-Seed, and so that is specifically marketed to fertility patients who are trying to conceive. And a less expensive option is using mineral oil. So that is very inexpensive. It can be purchased at your drugstore and it won't harm the sperm. Next is using ovulation predictor kits. So those are kits that you can buy over the counter. They're located next to the pregnancy test kits, and it's essentially something that a woman pees on a stick a few days prior to ovulation. It should be negative, and then when she's ovulating, her body will send out luteinizing hormone, and the kit will pick that up, and that will be the signal that she's about to ovulate, and so then she can time her intercourse better. Lastly, there's positioning after sex. So for most women who have an anteverted uterus, the uterus is kind of tilted up like this. Now after sex, if a woman were to put some pillows underneath her hips and tilt up her hips like this, the semen is then going to pool up near the top of the cervix here, and so it's going to have a better chance, the sperm is going to have a better chance of actually entering into the uterus where it needs to be. So that's it. So pretty straightforward. If you have any questions about this, my name is Dr. Derek Haas with Conceive Fertility Center, and we'd be happy to consult with you if you have any questions. Thank you.